All right. So, moving along. Now we'll start talking about different parts of the immune system. So, adaptive and innate, all that good stuff. So, innate is what you're born with. This is just day one. You have this. It is very lame, okay, if you will. It works, but it doesn't work that great, okay? Adaptive is something you acquire over time. So once you're born, about a month or two out, really within a couple weeks past birth, you start to develop adaptive immunity. And what this is this archive you build of every antigen, surface marker, of organisms out there, and you create a unique lineage of white blood cells to deal with it. Okay? It's like you creating a key for every door you come into contact with. And that key only opens that door, and that door only has one key that opens it. All right? That's adaptive immunity. You create this specialized cell lineage to everything all throughout life. Every time you get a cold and it's a different virus, you get immune to that. You get a vaccine, you get immune to that. Whatever that organism we're vaccinating against. The problem is things mutate. We decide to do vaccination schedules on our own schedule because we think we know better than the CDC, who has done countless studies on huge numbers of people. But, we read about one case on the internet where someone's kid, developed a fever or something after having a vaccine. Lord help me. Okay. Vaccines are good. All right, people. So, you can tell how I feel about vaccines. Physical and chemical barriers. So, mucociliary escalator, for example, in your trachea here, we have goblet cells that release mucus, and then we have cilia. And what the cilia do is they beat up, and then goes to our esophagus, and we swallow it and send it to our stomach. That's not a problem because in our stomach we have acid. We can kill things. All the food you eat has bacteria on it. Okay, we are constantly consuming bacteria. You have bacteria in your mouth. You are consuming that. And so we have something to help regulate that bacteria from entering our system, acid. The breathing in, mucociliary escalator. Okay. Layers of skin that allows us to shed bacteria. It also prevents the bacteria from being able to migrate deep into the bloodstream. Defensins, these are protein structures that can damage bacteria in our sweat, on our skin. We can see them in other areas as well. Mannose binding lectins, so this is like PAMPs, PRRs. So what they're looking at is these different mannose structures on the surface of bacteria, identifying it, and from there we can go through activating complement or releasing antibodies to deal with the organism. So, characteristics of adaptive, it's specific to one antigen, one key to one door. Okay? Memory, it should last a lifetime, but the body is lazy. Okay? If I get exposed to a cold virus when I'm 5, and I create the antibodies against it, the white blood cells to deal with it, but I don't see it again for 60 years, my body is not going to maintain that cell lineage. And so we lose it, and then we get older, we start catching colds more. If you think about it, little kids, never stops running. Just snot factories, all right? Think about it. Everyone knows that has a little nephew, niece, something, a little brother, sister. Snot factory. And then you hit 12, 13, 14 maybe, and you don't get colds as often. But when you do, especially now at y'all's age, it wrecks you, right? You get a cold now and it's man, I'm out for a week, okay? You get old like me, you're out for a month. That's it. Immune system, that's What's happened is it's one you've never seen before or you lost immunity to, and that's why you're dealing with it. The cold virus, there's like, man, I can't remember if it's 100 plus or 300 plus different variations of this virus. And so that's why it just takes a long time to build up immunity to it, and we can never create a vaccine against the cold. That's the reason, okay? But then you get older, and you notice like elderly people tend to get sick more often. Well, they don't go out as much, they're not interacting as much, and so what happens is this cell lineage is not getting stimulated again. And so the body eventually goes, why am I maintaining this? This is a waste of energy. I don't see this anymore. It's not in my environment. Get rid of it, okay? Immense diversity, it's infinite. Any antigen it comes into contact with, it can create antibodies and white blood cells that are able to identify it. Okay. Humoral and cellular, we'll look at that, but basically one side is antibody and one is going to be cell-mediated killing. So there's two branches to adaptive. All right. So here's the quick rundown. You catch something gets inside of you. Any white blood cell that can eat, can phagocytize, is an antigen-presenting cell. He eats the invader, breaks him down using a phagolysosome, and then presents on what is called MHC2. MHC2 will train the CD4 or helper T cell. That creates memory helper T cells for the future, specific to that invader, and effector, which are active cells. Active CD4, trained, non-naive, okay, helper T cells, or CD4. He has two names, okay? And it's just due to the markers on the surface of him. He is a lymphocyte. He's just a specialized lymphocyte. He will train our two pathways. Here, this is the humoral, okay? We have a naive B cell. I mean, he doesn't know anything. He got trained in the bone marrow just to be a B cell, and that's it. We train him. He creates memory B cells for the future. Then he turns into a plasma cell. That's his active version. He pumps out antibodies. From here, invader, to go through this process to train the B cell, plasma cell to make antibodies, how long do you think that takes? You get a vaccine, you get a cold, you go through this pathway. How long does it take till you get here and you start to have immunity? I ask this because it's rare you get it, like someone gets it right, but it's 2 weeks. 2 weeks before you start to generate antibodies. The reason I say this is like flu shot, here, helper T cell, effector, plasma cell, antibodies, immunity, about 2 weeks. And so you hear all the time people, oh, I got the flu shot and I still got the flu. My next question is, how long after your flu shot did you get the flu? And had someone recently tell me the same day. And I was like, well, you already had the flu for several days. It's not going to do anything for you at that point. So it's important to vaccinate early in that situation, okay? And then we have the other pathway. So same thing, the effector T cell or CD4, the activated helper CD4 cell will train the cytotoxic T cell or CD8. This guy, when he is trained, he'll create memory for the future and he'll create the effector active. These guys will look for infected cells, intracellular organisms inside cells. Those cells can hold up a sign and say, hey, I'm infected, come destroy me to get rid of what's inside of me. So CD4 and APC, we're going to jump back here for a second. On the APC, he has MHC1. Okay, so on his surface is MHC1. Sorry, MHC2. MHC2, major histocompatibility complex 2. On the CD4 cell has MHC2. This is the sign holder. That's where he places the antigen so CD4 or helper T cell can read it. So remember, MHC2 communicates with CD4. On the surface of your regular cell, so let's say we have a cell and it's infected, he'll present on MHC1. Okay? MHC1 is read by the CD8 or cytotoxic T cell. So 1 and 8. Okay? So always remember 2 times 4 equals 8, 1 times 8 equals 8. Meaning the 2 is the MHC2 CD4 cell, 2 times 4 equals 8, MHC1 on your infected cells, and your CD8, 1 times 8 equals 8. Okay? These are these direct communicators. The problem is when you talk about like cancer cells, for example, they turn that off. We can't see that it's bad, right? If an organism turns off that structure, can't communicate. Or if an organism infects a cell that does not have the ability, and really the only one is red blood cells. They do not have the ability to create this protein structure, MHC1, and alert that they're infected. So like when people get malaria, which infects the red blood cell, there's nothing they can do about it. They must take a medication to get rid of it. Okay? Every time you're exposed, the memory cells will increase in number and they become active to deal with it. So what you're doing is, say you get a vaccine that has several stages, like Hep B. I think it's a 3-part vaccine. What we're doing is the first vaccine gets you to a certain point. The second one takes you to another point. The third one takes you to another point. Same thing with like boosters, okay? Whenever we have to take boosters, that's what we're doing. And the reason we're doing that is there is a point we must cross, okay? So like this line right here. And what that line represents is the volume of antibodies in your body against that organism. The goal here is when we know you're at that level antibody, we know that you're going to have immunity. This is titers. Whenever you go get measured for titers, what they're measuring specifically is the level of this guy. From there, we infer you have enough white blood cells, B cells, okay, activated plasma cells, to handle this infection if you come into contact with it. And the assumption is, well, if you have plasma cells, you have CD8 that are at the appropriate levels as well. Okay? If the titer is low, you must get revaccinated. So the problem here is, this is where I was talking about, like when people go outside of CDC scheduling. Well, you're still going to give your kid the 3 shots, and the complaint is, well, it's too much pain for my kid. I want to spread it out. You're still going to give them the 3 shots, so the pain is still there. But now they have no immunity against this organism, and they're going to get it, and it could, kill them, do whatever. Okay, so not a wise choice to do. Go by the scheduling, okay, people. So IgG is our long-term immunity. This is the standard antibody. It has 2 binding sites. These take a couple weeks to make. Okay, this is like the 2 weeks to make this. IgM is the very first antibody you make. So when someone has an active infection, if we see elevated IgM levels to that organism, we know they have that infection right in the moment. So sometimes that's how we identify, when we do certain testing like Hep C, Hep B testing, we can identify it by IgM levels for like the shell or whatever, the DNA of the virus. IgE plays a role with eosinophils and mast cells. It mounts to them. That's where the antigen then would come and mount to it and cause the degranulation. IgA, this is what you find in secretion. So all throughout your GI tract, saliva, as well. Okay. IgM is also found in like mother's milk. So this is the antibody we pass over. And that brings up another point. Like, there's this big thing where, like, people are like, yeah, the milk is great and how long you breastfeed for is important. Yes, 100%. Okay? But the kid eventually starts to develop acid in their stomach. Eventually, this method is no longer has meaning. Okay? That antibody crossover, not going to happen. This also cannot cross placenta. The reason I brought it up too is because there was a show recently and these adults were consuming women's breast milk, believing it was causing better healing. One guy was convinced that it was curing his prostate cancer, which he never had an official diagnosis for. Another guy was a bodybuilder. He was buying some random lady's breast milk off like Facebook Marketplace. Diseases can be passed that way. Not wise. Okay. Anywho, IgM cannot cross the placenta. However, IgG can. So when the baby is born, everything the mom has been vaccinated or exposed to, the baby temporarily has protection. That protection is not going to last forever because it's only going to last a couple months because they don't have the white blood cell, the activated plasma cell, okay, that trained B cell to generate their own IgGs, to generate their own antibodies. So they must get vaccinated, exposed, all that good stuff. Okay, IgD just speeds up the process of, I believe it was IgE. Okay, not a huge role that we know of. All right, so antibodies, what do? They can bind to viruses, causing virus neutralization. Okay. What happened to my pointer here? There we go. All right. So by binding it, the virus cannot enter into the cell. So we're blockading it. Bacteria, it can activate a complement. There's that membrane attack complex. It can neutralize by binding to it. So toxins, for example. So this is where you talk about like antivenom. That's what antivenom is. Antivenom is just antibodies they've created in another organism, captured them, and then give them to you. So usually what they do, it's in horses. Horses can tolerate a little bit of venom, and so they'll generate the antivenom for all the snakes in your area, and that's it. And so if you go to the hospital because you got bitten by a snake, you don't need to bring the snake. Trust me, you don't need to bring the snake. And then they would give you the antivenom. So a couple cool things about antivenom. My brother-in-law, he's a physician. So when he was in he's a colorectal surgeon now. And so when he was doing like his general surgery, one day someone got bitten, down in Florida, someone got bitten by a snake. They killed the snake and burned it. They were very thorough, and then brought it in, and he sends a picture, and there's literally 3 residents sitting there trying to figure out what type of snake it is. Just don't need to if it is a natural venomous snake in your area. This is why it's illegal to have venomous snakes as pets, because someone could bring something in that we don't have the antivenom in that area for them. Okay? The next interesting thing, antivenom. There's a fox walking through my neighborhood. Just noticed it out the window. Anywho, antivenom is kept at Hartsfield-Jackson. So at the airport right there, they have a special site. That's where they keep it. And if someone gets bit in a local hospital, wherever, they will immediately lift it to them. Antivenom is ultra expensive. I think it's something like $30,000 a dose. It's very expensive because you got to keep the horses and all this and those venomous snakes. It's a very expensive process. My wife was telling me, we were watching something about 9/11 recently and like how they did an all ground stop. And so, in these documentary stuff, they talk about, the president and a couple fighter jets were the only ones in the air once that happened. That's actually not true. There was a couple life flights in the air. There was a couple people getting antivenom delivered to them, which was pretty neat. They didn't stop that, right? So it is life saving. Yeah. Anywho, we also can trigger opsonization, so increased phagocytosis, just the same way as C3b. All right, secretory system. So this is where you talk about in like the GI tract, IgA. There can be IgG, IgM. Peyer's patch, that's in your ileum. That is a large organization of white blood cells. And so where it is, it's right at the end of the small intestine going to the large intestine. Large intestine is primarily bacteria. Small intestine really isn't much. And so it is there to stimulate your immune system constantly and keep that stuff at bay as well from migrating through your system. Salk and Sabin, this is kind of an interesting point here. Salk is the killed smallpox. Yeah, smallpox vaccine. Okay. And no, polio. It's polio. It's polio. Okay. It's been a while since Top Micro. Salk is killed. That's what we used here in the US to prevent polio. Overseas, they would use Sabin, a live oral vaccine. The risk there is, if it's a live vaccine, there's risk that you catch that illness. Okay, organism can take over, you catch the illness. And so it's real risky with like polio. It's not worth it here in the US because the amount of polio exposure was very low. But because of that oral and it hitting the mucosa and it being a live organism, the immune response was much, much larger. The other thought process is, in third world countries, stuff like that, the sanitation standards are not the same. Vaccines are not free. Here in the US, vaccines are free. If you can't afford it, you go down to the health department, they'll vaccinate you. Okay? Or Grady, health department, right? Is in other, third world country, whatever, sanitation standards aren't the same, vaccines aren't free. That means the wealthier population can afford to vaccinate their children. And so the thought process is, if it gets into the water and, someone less unfortunate drinks that water because of the sanitation standards, they may develop immunity. That's a big reason why they used it. Okay? So, just kind of fun fact there. All right. Here, I get exposed to something. I get a vaccine. Okay? Get my flu shot. Early. Like in June. All right. August. Okay? And aim for like August. Okay? Maybe October. All right. IgM is that initial response. That means I just got the vaccine. That's the first to be produced. About 2 weeks later, I produce IgG. And we don't sit and pump out tons and tons, but there's small amounts being pumped out. Now, I get exposed to the flu in December. What happens? I may feel a little iffy for a day or two. You ever feel that? You feel like, I feel a little under the weather, but not that bad. Like, I don't feel sick. I just feel iffy, right? A little groggy, maybe a smidge of stuffiness, something. And then by end of the day or next day, you're like, I'm great again. That's this, okay? Your immune system is coming online. You start dumping IgG out, and you handle it. You take care of it, okay? So every time you get exposed, that IgG is also going to stay a little higher because we have more memory cells produced, more and more troops to deal with whatever illness we're coming into contact with. Passive immunity, this is, you talk about like mother passing on IgG to the child. So here at birth, we're at peak, and what happens is they start to taper off. Meanwhile, we're vaccinating the child. They're getting exposed to things. They're building up their own immunity over time. All right. So, different types of immunity. Natural passive immunity. Your mom got the flu when she was right before she was pregnant with you, or when she was pregnant with you. Mom got the flu. She created antibodies to something naturally in the environment and then gave it the antibodies to you. It's natural because it was a natural occurrence. She just caught it. It's passive because you don't have the white blood cells to produce the antibodies, but you have the antibodies temporarily. Okay? Artificial passive immunity, this is when we vaccinated your mom while she was pregnant for like MMR, measles, mumps, rubella. It's artificial because we put a needle in. It's passive because you only have the antibodies. Okay? artificial active immunity. You get a vaccine. We give you the flu shot. You create antibodies on your own because you have the white blood cells to generate them and you stimulated them. Natural active immunity. You caught the chicken pox. Okay? You caught the flu. Naturally occurring in our environment, we created immunity to something. There's a problem here. There's a lot of times you get the statement, well, I naturally rather get sick and develop immunity and I'll be good. The problem is your immune system, you may already be sick. It's busy doing something. That's why they say, like, if your kid's sick, you can't bring them in for vaccines. It may not create the immunity. It is a wild type, so it could be a little tweaked, a little different, and so you could catch a different type, the strain, and pick it up, no problem. Or you get really sick, we somehow intervene, your immune system never kicks up enough to deal with it. Does it work? Yeah. Like, I had chickenpox as a kid. Did I ever have chickenpox again? No. Okay? But there are risk factors there. You know, with chickenpox, for example, you get all these lesions on your skin and stuff, and I'm scratching, because every kid is doing that, and you could get a bacterial infection in it. Why? High fevers. I remember I had an insanely high fever when I had chickenpox, to the point where I remember my mom calling the pediatrician and them telling her, you have two options. Like, she had already given me Tylenol, I believe, and it wouldn't come down. I was at a 106. Very high fever. Okay? Explains why there's a lot wrong. Just kidding. My wife will agree with that statement, though. Anywho. I remember the pediatrician told her you have two options. Either you call 911 or you throw them in an ice bath. My parents are foreign, so you can guess which I got. The ice bath. So, did it bring down my fever? Yeah. But it's a risk. What if the kid's asleep and that happens? Okay. So that's why we do vaccinations. So everyone that's vaccinated against chickenpox now, you have the immunity, you didn't catch the chickenpox. We're both at risk of getting shingles because it was a live vaccine, but you didn't get all the illness. Okay. Artificial passive immunity. Another example of that would be antivenom. That's another one. Okay. All right, immunodeficiencies, primary versus secondary. This is when primary, it's really, you think genetic defect. Okay. Secondary is due to something else. So like primary, I develop osteoporosis because it's in my genetics. Secondary, I develop osteoporosis because I never take calcium. Something like that. B and T cells, when you lose B cells, you're at a high risk of developing like bacterial infections because that's what antibodies are going to deal with. If you have a T cell deficiency, viruses. And then there's combined. That's SCID, severe combined immunodeficiency. If you ever seen the movie like Bubble Boy, there was another one. Was it Everything is Everything? It's the one where the girl's like in the house and the neighbor, they fall in love, but she can't come outside because she has some illness. That's SCID. And that's what the mom was like faking that she had or something. Okay. We can have complement deficiencies, like I mentioned, bacteria, virus, all kinds of stuff, depending on which complement, how severe deficiency. All right. A lot of secondary causations here, and we'll talk about a bunch of stuff as we go through the rest of this semester. Right. Hypersensitivities. So there are 4, and these are basically different types of reactions that we're having upon antigen exposure. So type 1, this is anaphylaxis. This is seasonal allergies. Okay? Typically, it's very, very fast. That's how you think of it. Type 2, this is tissue destruction. So like Graves' disease. Okay? Type 3, this is antigen-antibody complexes forming, depositing in the tissue and causing damage. So like lupus. And then type 4, delayed, this is your poison ivy, skin reactions, or PPD, which is the test for TB. Think 48 to 72 hours after exposure, you get a rash. So type 1, you technically must be exposed once, no reaction, on second exposure, reaction. So you get exposed to peanuts when you're 10 years old. Never been exposed before. You go through the process, you train the B cells, plasma cells, and you generate IgE that mounts onto mast cells. And they're just hanging out. And then, a few weeks later, you eat a PB&J, the antigen binds to the antibody, mast cells degranulate, reaction. There should be a first exposure, no reaction, second exposure, reaction. Now, that being said, for example, I'm allergic to wasps. On my very first sting, I reacted. I got stung in my right ear. My left arm became like triple the size. All right. My dad is deathly allergic to fire ants. There's some genetic component there that was passed on, and that's why I reacted the first time. Somehow, I had IgE that was already created and ready to go. We don't know how this happens, some of these like very basic antibodies without exposure and generating, we don't understand that yet. Like how do you know in your blood, for example, if you're A blood type, how the heck did you make B antibodies without being exposed? We don't know. Okay? Somewhere in our genetic coding, it's just there. All right. So type 2, this is antibodies against tissue. So for example, myasthenia gravis. This destroys the acetylcholine receptors on the synaptic cleft of muscle. Okay. And so on skeletal. So what happens is they release acetylcholine, but the receptors are gone. They can't stimulate the muscle. So there's easy fatigue. The eyelids are usually droopy. Okay. Rh incompatibility. This is if you're a positive or negative blood type. Okay, so we can get incompatibility there. Destruction of the red blood cells. Rheumatic fever, endocarditis. So what happens is people get strep throat. They don't treat it. And their immune system creates antibodies against the surface of the heart valves. So this M protein looks like the antigens on your heart valve. It gets confused, it attacks it, and so you develop this endocarditis, okay, inside of the heart inflammation. It can destroy the valves, you can end up with permanent murmurs, you can end up with needing valve replacement, and so that's why strep throat must be treated. Okay. Type 3, these are antigen-antibody complexes. What happens is they deposit in the tissue, neutrophils respond, neutrophils release lysosomes, oxidative agents, they destroy the tissue. So some examples here, Raynaud's phenomena, damaging the capillary beds, destruction of the nephron, okay, the glomerulus, Bowman's capsule, all that. That's PSGN, post-streptococcal glomerulonephritis, and then the Arthus reaction that we see in lupus, this butterfly malar rash is what it's referred to. This guy down here, you get strep throat. You don't take anything for it. It resolves. And your body gets confused. It generates the antigen-antibody complexes. They deposit in the small vessels leading up to your nephron, and it destroys your kidneys, and you have kidney failure, like overnight. Typically, we see it in teens, roughly, somewhere in there. Usually it's younger teens. I did have a friend that when he was like 19 it happened, and he had to get a kidney transplant. All right, and then type 4, this is cell-mediated. This is where we present MHC1, CD8 reads it, and we get a reaction. So for example here, post exposure to poison ivy, those oils in there, it takes a bit. Your PPD test for TB, it takes a bit for the cells to migrate there, respond, and create an inflammation under the skin of the arm if they're positive for TB. Exposure to certain metals can trigger it as well in certain people. Autoimmunity, so this is just, it's one of these hypersensitivities, essentially, destroying the tissue. There's tons, and we'll look at many of these as we go throughout the semester. Okay. Make sure you guys understand these terms and where antibodies are located, okay, what cells are involved. Make sure you understand that pathway that we talked about, how to activate CD4 and CD8 and the B cell. All right, and that's it for this section.